In 1984, a doctor was so sure he was right, he drank a beaker of bacteria to prove everyone else wrong. Now that's dedication. His name was Barry Marshall. He and his colleague, Robin Warren, had a theory that seemed wild at the time. That stomach ulcers weren't caused by stress or spicy food, they were caused by a bacterium called Helicobacter pylori. The medical world thought this was ridiculous. They thought there was no way any bacteria could survive in the acid of your stomach. Marshall had the data. He'd seen H. pylori in ulcer patient after ulcer patient after ulcer patient. Journals rejected it. Conferences ignored him. Doctors have spent decades treating ulcers with antacids and surgery. Nobody wanted to hear that the answer was as simple as antibiotics. So Marshall did what any completely reasonable scientist would do. He grew a culture of H. pylori in his lab, mixed it into a broth and sent it down his gullet. Within days, he developed gastritis, inflammation of the stomach lining, the very precursor to an ulcer. He'd given himself the disease, and then he went on and cured it with a course of antibiotics. His wife wasn't thrilled, and technically it wasn't fully ethical to experiment on himself without proper approval. Marshall was done waiting for a system that kept slamming the door in his face. In 2005, Barry Marshall and Robin Warren were awarded the Nobel Prize in Physiology. Millions of ulcer patients now get cured with a 2-week course of antibiotics instead of a lifetime of pain. All because one man trusted science enough to follow his gut.